Yo, yo, everybody, what is up? It is your friendly neighborhood physical therapist, Dr. Ryan Welton, coming to you from just outside the beautiful Tampa Bay area. If you are new to following me, I have a chronic pain clinic. I call it the I've failed everything clinic because that's what a lot of people tell me in here. And I've learned to get exceptional results over my career in this patient population. I generally do not worry about the rehabs part of it. And I actually link below should be my school group. So you can join my free school group for rehab clinicians only, my free school group and that with the school group, you get access to more clinical teachings, more in depth by me. And then also you get access to my cash-based clinic mastery teachings. Um, so I so a lot of people know me as this clinical expert guy. I published statistically historic papers in the field of orthopedics that are multiple times even what the New England Journal of Medicine, the Lancet, um, JAMA, even those medical journals, these things are off the charts. Go to my social media, whatever social media you're on. I pinned it to the top of most of them, the analytics from the journal, 3 to 5 years post publication. There's still 12 months, like in the last 12 months, they're still getting that type of readership, which is multiple times even the biggest journals in the world. So there's a reason why these things are viral and they continue to go viral is because of I've been using these things years and I don't have issues, generally speaking, when it comes to these diagnoses. Now, I also have my clinical mentorship is live now, where you get 59% off all of my courses. So my myofascial courses, where I detail in a paper how their reflex pain points, I call them, where they shut pain off immediately, is what I detailed in case studies. And then I also have my orthopedic protocols course, which is the protocols that I use in here. The kicker is I do the same thing with everybody, each diagnosis. And my sciatica cervical radiculopathy course, which helps me relieve most of my patients' pain with those symptoms. And then access to more in-depth teachings. I'm an innovator. So you can join my clinical mentorship. And then I also have my business mentorship. So what I have been doing for the last several years is quietly helping people open and run a 7-figure model. This is very different. One therapist, you can do more if you want, but one therapist, 7-figure model, where you get paid for not communism, not the communist medical system where we all get paid the same, like same, $50 from United Healthcare, whatever, which they never get involved with, which is a scam. It's a patient paying it all. Whether you invest in your education and go much deeper to try to help patients, or you don't. We all get paid the same. I think that's a scam. And what I did was I jumped ship years ago. I've been in business about 17 years. I jumped ship like early on, and I had a cash-based clinic and now I'm teaching people how to open and run these cash-based clinics based on clinical outcomes the way it should be. So patients will pay cash at a premium if they know you know what you're doing. So I charge for over $400 for 30 minutes and of my time. And but the patients in here have a pretty good idea that I know what I'm doing because I get them out of pain immediately, generally speaking. Not some fancy sales techniques. I don't teach sales techniques. I'm not a natural salesperson, and I don't teach sales techniques. That you demonstrate your clinical results and show them how you got there and what you need to do to fix it, and then people trust you. No fancy sales techniques manipulating people's brains. So if you want to, so what I did for that business model is I combined it with my clinical mentorship. So you'll have a clinical expert and a business expert in this model that I do, where I show you how to target everything. I show you how to target these chronic pain patients, bring them in, and I show you what I do with them to help these people. And I got this thing streamlined, and now I'm teaching other people to do it. So there's limited spots on both the clinical mentorship and then the business clinical mentorship. Okay, you can go to the school group, or if it doesn't show up on what you're looking at, go to weltonmethods.com and click become a VIP member, and that takes you to the school group. And I'm posting more deeper clinical insights in there. Okay. All right. So today I am talking, the name of this video is root cause of carpal tunnel syndrome. So I will never forget. First of all, I published a paper in the Journal of Practical Pain Management called Root Cause of Carpal Tunnel Syndrome, which I propose in that paper. And in the whatever cases, how many cases I outlined in there that worked, I just applied this protocol. That carpal tunnel syndrome, the story of my that protocol and how it came to be, and the new diagnostic procedure that I put in there, that I came up with, is years ago, I remember working on a patient and she had a carpal tunnel release, right? But then she got carpal tunnel again. And I'm like, how does that happen? How does someone have a ligament cut to make room inside the tunnel and then get carpal tunnel again? How does that happen? And what I realized is I had this insight. I remember where I was sitting. I had this insight. And I'm like, what if it's actually coming from, a tight posterior capsule that's pushing the carpal bones anteriorly, okay? And to this side here, compressing the median nerve in here. What if it's that? So I started checking people's posterior capsules, and one after another after another after another, I would see a tight posterior capsule on these people, and I'm like, I'm like, wonder if it's that. So I started using this protocol to address that. Okay. And since then, I don't remember the last person with carpal tunnel that I couldn't help. And that was probably 10 or 15 years ago, I would say. I don't recall. So anyways, you can find that paper on my website, weltonmethods.com. Go to publications and you can read my papers. I go much more in depth. I'm going much more in depth in the diagnostic of carpal tunnel. I altered Phelan's test, great test, but I altered it. And to make it what I believe, if it's studied, to be more accurate. It needs to be studied, but it helps me in here. So anyways, if you want to do that, join the school group. It should be linked here, or go to weltonmethods.com, become a VIP member, and I'm teaching in there. Okay. And but carpal tunnel syndrome is not something that I worry about. My patient's getting better. I don't feel worried about that. And I use that protocol. Okay. Anyways, if you want to join my clinical mentorship, where 59% of my courses plus live with Q&A teachings in there, and much more deep into this stuff than I do here. And then my business cash-based clinic, one therapist, 7-figure model, and have the clinical skills to be confident to charge that. You're investing all this time in your education, and you get paid the same as everybody that's not investing that time. You know what I'm saying? That doesn't make any sense. If you invest time and you're an excellent clinician, which is my goal to make you an excellent clinician, then you should get paid accordingly. In every other industry that I can think of, lawyers, whatever, accountants, if you're good at what you do, you get paid. But in this industry, it's communism. I don't do communism. So that's that. But go and join that free school group, okay? And I will see you in there, okay? Peace. Love you all.